next question is how to understand your treatment plan. So, just coming off this whole conversation around the dental health insurance and how to best understand that, this is a really great lead in if we could explain to people, when you go to the dentist and they do an examination and they diagnose a problem or disease, they should give you a treatment plan, which is basically a written quote that outlines the treatment that you or that they're suggesting or recommending, however you want to use it, that you have done. But people often take this piece of paper and they don't know how to read it because it does have these things on there called item codes, which is how, as a dental practice, we communicate with your health insurance company to let them know what the services are that you are either going to have done or you have had done so they can then pay out your rebates. If I can, we're the tech savvy people, so I'm going to try and share my screen so I can show you an example of what a treatment plan looks like. So let's see how we go.
Good luck, Beck.
Yeah, I know, right? Okay, here we go. Now I think everyone's looking at you, so I'm going to minimize you. And now everyone should see the treatment plan, Heath.
Yes.
Okay.
So interestingly, just for everyone's, the fact is that these item numbers only came into existence because of insurance. So dentists themselves, we used to just write out what we did, and then that was it. There was actually never any item code. So this is purely for your insurance company, which I didn't know until I kind of got out of dental school, which is really odd. Yeah. Sorry, Bex, keep going.
No, well, this is actually your thing, but I understand why it's come in, because if we were all trying to, speak the same language in terms of, explaining what a restoration is or a filling or, so the item codes do certainly serve a purpose and make everyone's lives a little bit easier. However, as a patient coming into the system and not really understanding it, not only have you just been told that you need to have work done, but then you've got to try and understand how to read this quote so you can find out whether or not health insurance is right for you, and what you're going to get back on your health fund. So here we are. We've done a bit of a mock-up of what a treatment plan could look like. Now, keep in mind that there is a few different accounting systems that practices use. So your treatment plan might not be laid out exactly like this, obviously, but there's 3 important things that it will contain that you need to be aware of. Did you want to explain it, Heath?
Yeah. So there's the ADA item code, which is a 3 numbered code, which you can see there. I don't know if you want to zoom in. Can you zoom in a little bit more there, Beck?
Oh, okay. Well, now we're getting a bit tricky because I'm not sure.
Can you just click the little? Yeah, there you go.
Okay.
Beautiful. So so when you go to your dentist, make sure you're always getting this purely just for your records. But as Bex was saying, every single treatment plan or quote should be made up of a code, which is what you can see there, Beck. I don't know if you want to point to 532. And probably, I don't want to go into what numbers mean what in this, but every one is a 3-numbered code or 3-digit code. Then you'll tend to find with each, and they are associated with a service as such. Even a consultation has a code, Crown has a code. So every little thing that we do will have a code. And it'll also usually have a tooth number associated with it, typically. And then you might see surface numbers if it's like a tooth as well, the 2 surfaces. But that may not necessarily be there for every single code that you get. Then you'll have a fee. And then for some practices as well, what they'll do is they'll integrate it into your, or through their software, they'll put a health insurance quote next to it. So it can sometimes also show you your gap for each particular service as well. But typically it's laid out per appointment. And we'll go through a certain stage of your treatment. It may be the whole lot, or it might be, if your dentist has decided to split it up into 3 or 4 different sort of stages, they might separate it out into different plans as well. It's a super complicated system. The codes change every year. The definitions change every year. Health insurance companies won't claim on certain ones in certain years. So I would just suggest that everyone gets one of these when they go to the dentist and they're getting a reasonable amount of work done so they can understand it all.
Yeah, and again, just ask the team if you're not sure what it means or how to understand this. You know, just take that time, because it doesn't have to be a complicated process if you just understand those three aspects. So the item code is probably the most important thing, because it allows you to be able to identify what it is you need and when you need it. So if you look at this particular treatment plan, you know, you've got 3 appointments: appointment 1, appointment 2, appointment 3, and the dentist has decided, you know, in best interest to, you know, maximize your time in the chair and what would be most comfortable for you. This is what we'll do at each appointment. And so, you know, if you understand, okay, well, I'm going to go and there's 2 things that are happening at this time. These are the teeth that they're going to be working on. This is where this 1, 6 and 1, 5. So every tooth has a number associated with it, which tells us where it is in the mouth, obviously. And then you've got your fees associated with that. So if you could just pull those 3 things from your treatment plan, you know, you can talk to your health insurance company and find out what your rebates will be. You'll better understand the process that you're going through for your general care. And then this is another reason we wanted to show you this, is because this is actually what AirSmile is all about. So hopefully you're watching this because you're aware of what AirSmile is. So Heath and I created AirSmile because we understand that this is actually a very confusing process for people to go through. And quite often what happens is they're handed one of these pieces of paper, and sometimes it has a lot more codes on it than this, and they're overwhelmed and they're not sure what to do next. And so they either fold it up and put it in their purse and forget about it, or they'll get a couple of things done, you know, the easy stuff or whatever, and then they never fully go through with the treatment plan or whatever. So with AirSmile, you can take this piece of paper and you can actually scan it in to the AirSmile platform. So you can either take a photo or you can upload a PDF like this. And we've trained our system to be able to read majority of treatment plans, where it will take that item code, so those 3-digit numbers, it will take a tooth number if it has one, and it will take the fee. And then you go through the process and you can actually get an instant quote comparison on the treatment plan that you're being given from that dentist. So you can then better understand the type of care that you want. Then you can filter through the different practices that we've got on board with us. So we're in Brisbane now. Every week we're getting more and more practices on board, and soon we'll be heading down south to Sydney and Melbourne. So we're really excited about that. But if you are in Brisbane and you are interested in, you know, I guess comparing the care that you're currently getting, even if you are happy with the dentist that you're currently seeing, it's quite nice to get like a second opinion, just to make sure. So you can do that really easily, like within a minute or 2. Once you've uploaded this, you will have access to our dentist members, and they will be able to provide you a total quote in comparison to the plan that you've been given. So that's one of the really exciting things that we've built into the platform on AirSmile. And it means that you actually don't even need to understand what this treatment plan is, because our system reads it for you. So that's another really cool thing. I'm going to stop sharing my screen now. Was there anything else that you wanted to add there, Heath?
No, just that, like, I think that was great, Bex, that whole summary. I think the thing that I would just encourage people is, it's just like with any purchase that you're making, you know, this is a quote. And I know seeing a dentist, you know, I feel it's very different to going to buy a TV or going to buy a car, but this is, you know, we're a consumer-driven society here. When you go and you make a purchase, whether it's a car or a TV or you're going to the dentist, you want to know you're getting value, you know what you want to know and be able to compare it to something. And it may not be that you're after the cheapest, it might just be that you want to seek out value and make sure, you know, you're getting like a good feeling about who you're seeing, how much they're charging, you know, how long it's going to take, all the different things. And this is just a great tool to be able to do that. You know, I would expect this kind of service in any purchase that I make. And so I'm really excited that AirSmile is able to actually offer that to give peace of mind, you know, so you don't get buyer's remorse.
That's right. Yeah. That's what it's all about on that platform. So yeah, we're really excited that that's out there now for people to be able to use. So check it out. It is at airsmile.com. Obviously, if you're watching this, you're following us on the socials. So we really appreciate everyone's support up until now. So yeah, we've got some really exciting things coming out. So even if you have joined the platform before and maybe it wasn't offering the things that you want, please continue to check back with it because we are in development all the time, building out these really great features that are going to help you to be able to control and manage your own dental care. So yeah, shoot us an email if you have any questions at all. And we really appreciate you guys joining us tonight. Thank you, Heath. That was great.
Thanks, Beck. Hopefully
we're
great. Tough questions. Yeah. Tough questions, but yeah, it was great.
Really
Thanks,
important.
Beck.
Yeah, no, that's great. And again, if you have any questions that you want us to answer on these live chats, please send that to hello@airsmile.com or shoot us a message through Facebook. That's fine too. But yeah, enjoy the rest of your evening. Thanks, guys.
Bye.